Well, good morning, everybody. And it's okay. It's coffee, and it's going to be moved out of here before patients come, right?
Absolutely.
And before Bruce walks around anyway. So for those that don't know me, I'm Linda Rodriguez. I've been here, well, I can't say a couple months anymore. It's been like 5 months that I've been here. And my position is basically accreditation regulatory compliance, meaning I don't want you to run from me when you see me. I'm part of your team. So we're basically coming around just to make sure that we are ready at all times. I always tell people, we're not doing this for Joint Commission, we're not doing this for Leapfrog, CMS, we're doing this for our patients. So when we come around and we have suggestions and we kind of ask you questions, know that it's because we want to make sure that our patients have safe care. We want to make sure that you have safe care. So it's not just about the patient, it's also about you guys. So when I first got here, we went ahead and built a program, which we call it CSR, which means Continuous Service Readiness. And it's basically for us not to get ready, Joint Commission comes, it's over, and we go back to our old ways, because that's not the right way, right? It's basically to continually do that. So a lot of times, for those of you that have taken psychology or have your bachelor's, know that it takes time to change a culture, it takes time to change a habit. So we want to continue to come and preach the same thing, that we just want everybody to practice safely, right? So if you're going to hear me just saying that, it's not about Joint Commission, it's about the patient and it's about you. We want to be able to take care of excellent patients, so patients want to come and get care here. We want to take care of you guys, so we want people to come to want to work here because we're taking care of our staff. And we want physicians to want to come and practice here because we know the staff is taken care of, the staff wants to work, and the patients are getting excellent care. So with all that said, when you see us walking around, just come ask us questions, right? My job, for most of you will say it's boring as heck, but I've actually enjoyed it because I'm learning so much. But it's to make sure that I keep up with regulation, make sure I keep up with the law, everything that's going out there. Things change constantly. So if you have any questions, anything's different, please come ask. We will be walking around. You'll see me around a lot. We haven't seen me lately because we've been trying to get ready for the mock survey. And yes, I did know when it was coming, so that's why you didn't see us for a little bit, because we were getting ready for that. But it's come and gone. And we found a lot of wonderful things. Now, for those of you who might wonder, that was not a Joint Commission survey, mock survey. That was actually a CMS survey. And for those that are not familiar with that, basically, you guys know that CMS, it's the ultimate governing body. They hire Joint Commission to go do the inspections and stuff for them. So we have different regulations that CMS has for us. Joint Commissions adds to those regulations. So it was a little bit different, that when we have our Joint Commission survey, they're gonna do what these people have done when they came, plus. So that's my job, to keep on top of that and to kind of teach your leadership, to let them know, here's what we're finding, here's the new things that are coming around. We're gonna be building a virtual page for everybody to kind of keep up with everything that's going on. So more to come, right? So mock survey, we just had that CMS mock survey. So you guys know how you did? Okay, we don't have the final report yet, but I want you to know that nursing did fantastic in this department. Fantastic. So we do have a couple opportunities with our anesthesia department. Where's my anesthesia? There's nobody here. But we'll be working with them on that, and we will be telling you everything that they found so you can help them out, right? It takes a team. It's not just one area versus the other. It's all of us together. One group fails, we all fail. And we're all here to make everybody successful. So we'll be giving you guys that information. I should have the report by next Friday. They usually take about 10 days. But they really did have a really good experience. And you guys were one of the lucky departments that they spend the entire day here. Following the patients and watching surgeries and recovery. One thing that stands out the most when it came to the PACU side was pain, right? And how we did that. So we'll have more information on that. We're gonna be doing audits and kind of giving you guys some dashboards and know how you're doing, to just basically make the experience better. And I don't know how many of you guys have had surgery. I've had surgery. I only had it one time, which is lucky, right? But coming out of surgery is very painful. And do you want your family members or yourself to go through that? Are they usually this quiet? Y'all usually this quiet? You're not this quiet because I've walked around here before.
Yeah, give us a little time.
Yeah, okay. Not enough coffee yet, right? Okay. But this is what we're here for. So does anybody have any questions, concerns?
So Linda and her team are the ones that you really want coming around asking you questions, because they are not judging us. If we don't answer right, they're going to tell us, and we're going to know how to answer it next time.
Right.
Okay.
And that's one thing I love about my job. I love to educate. I don't expect you guys to know it all. Please do not expect for me to know it all either. I may not have the answer, but I'm going to go get it for you. And I will come right back and let you know. But yeah, don't get nervous. And if you see something, you see us in the hallway, stop us and ask the questions. You know, you care about your patients. You wouldn't be here if you didn't care about patient care. But yeah, that's what we're here for, to educate. One of the toughest things for me, because I've gotten around so much in the hospital for this past 5 months, was when the surveys come, I have to be locked up in a room. And it's like, I just want to be out there with them. So it was great. Everybody did wonderful. So for the next time, that is the real thing. Now we are in the window. I'm not going to here trick anybody, or we don't want that. I don't want that. I want people to be ready. But for Joint Commission, we don't know when they're coming. The mock we did because we paid for that and we set the date. But with Joint Commission, you guys know is supposed to be every 3 years, and they give us a 18-month window, so they can come anytime from 18 months. We are at 12 months away from the last survey, so they can really come at any time, which I hope didn't come immediately, because we learned a lot of great things from the mock survey, so we need a little bit of time to fix those things. But if I knew, I would let you know.
And then we harp on things every morning at the huddle, and I know Amanda probably does too with her team. Hats over hats back in the OR. Masks up or off. If you leave the OR, you have to have your mask off your face, unless you want to leave it up. If you are walking around in the OR, no blankets around your waist. You know, they're fine out here, but back there we have different things to follow. When you do your timeouts, have your consent in front of you. The nurse initiates it. We need our whiteboard completely filled out. If the doctor says the procedure, everybody in the room has to agree to that. What else, Linda?
And that was the one thing that they found in the OR was the timeout.
Mm-hmm. Yep, and fire risk. We have to do fire risk every time we do timeout. Yeah. Amanda, what did they find on your side?
I think it was mostly just charting stuff.
Yeah.
The
So charting stuff. We found there was a lot of things that they found that we can't do anything about. So like facilities. There's rooms where we have to have a different kind of floor and a different kind of ceiling. We can't do anything about that.
Right.
But the things that we can change, I think Amanda and I kind of harp on a lot.
Well, and the other thing that I talk about when I come and do rounds, you know, like Donna just said, there's a lot of things that, you know, we can drywall at home, but I don't drywall in here. But it's your responsibility to still notify, right? So we are working on a work order system. So excited about that. But we need to notify your responsibilities. Facilities, Donna, Amanda, myself, we can't be everywhere at once, but you are, right? And you can tell us that's your responsibility. Hey, this is broken, we need it fixed. And we'll be tracking it and have a timeline and all that kind of good stuff, kind of like IS does when the tickets open and then they close it, they let you know. We're kind of working on that kind of system, so it's really exciting. More to come for that.
Anybody have any questions for Ms. Linda? A little better understanding if you've never been through a survey of kind of what we're going through?
Okay. And I brought some of my cards. I'll leave them up here.
Perfect.
For you guys to grab them. Call me, holler at me. I'm here for your service. And hey, listen, for what I've observed, I wouldn't mind having surgery here. I don't want to go to surgery, but if I had to, I would allow you guys to take care of me. All right.
Thank you, Linda.
Thank you, guys. Have a great day.